Hello, good evening, everyone. Today we are going to talk about nephritic syndrome. Nephritic syndrome is a glomerular disorder characterized by glomerular inflammation and bleeding. What happens in nephritic syndrome? There will be immune complex deposition within the glomerulus. These immune complexes activate complement, and one of the byproducts of that complement is C5a. So the C5a will attract neutrophils, will attract a lot of neutrophils into the glomerulus, causing inflammation and inflammatory injury within the glomerulus. The clinical feature of nephritic syndrome, it includes, number one, we have hematuria. Hematuria is a classical feature of nephritic syndrome because patients with nephritic syndrome will present with hematuria. And the hematuria is the one that differentiates nephritic syndrome from nephrotic syndrome. Patients with nephritic syndrome will present with hematuria, while patients with nephrotic syndrome will not present with hematuria. Number two, we have limited proteinuria, less than 3.5 grams per day. Then number three, we have oliguria and azotemia. Oliguria is what? It's nothing but decreased amount of urine, while azotemia is the accumulation of nitrogenous waste product within the blood. So number four, we have salt retention with a periorbital edema and hypertension. Usually patients with nephritic syndrome will have salt retention with a periorbital edema and hypertension. Number four, we have red blood cell cast in urine. Also, red blood cell cast in urine is what differentiates nephritic syndrome from nephrotic syndrome. Usually, it is the only patient with nephritic syndrome that present with a red blood cell cast in urine. So, causes of nephritic syndrome. Number one, we have post-streptococcal glomerulonephritis. Post-streptococcal glomerulonephritis, it usually occurs after group B beta hemolytic streptococcus infection of either the skin or pharynx. So that beta hemolytic streptococcus is nothing but Streptococcus pyogenes. So it occurs after that infection. And also it occurs only with nephrogenic strains. What I mean by nephrogenic strains is the ones that carry M protein balance factor. And also post-streptococcal glomerulonephritis, it may also occur with non-beta hemolytic streptococcus organism, but in rare cases. So